Hello, everybody. This is Oran calling you at 6 o'clock in the morning from Kuala Lumpur. So welcome to this pilot group coaching. In this video, I'm going to be answering your questions about Ontake warm bamboo. In case you don't know, I'm the author of MOXA in Motion and a teacher of the Ontake method, which is using this amazing MOXIBUSTION tool. If you can hear me and see me loud and clear, please hit the like button, or if you really want to make me happy, then hit the wow face. Well, thank you all for joining and watching. It's my first time to do this, so there may be technical errors, but we'll see what happens. I've scheduled an hour for it, but I don't think it's going to take that long because Facebook being what it is, we all like to have things short and sweet, and also we all have busy lives. I know that in the UK it's already 10 p.m. And I'm not sure what time it is in the US if there are people watching there. So what I'm going to do is start off with 3 tips that I think can help your Ontake practice. And then what I'd like you to do, hi Galina, what I'd like you to do later is post some questions and I'll try and answer them live. So it's really great to see that Galina is online, so that at least I know one person is watching and that the broadcast is actually going out, so that's great. All right, let me start off with 3 tips. Hi April. The first thing is, how can I control the heat of my Ontake? When I teach, and also when I see discussions in the group, some people complain that the Ontake is too hot. Either it's too hot for them holding it, or it's too hot for the patients. So let's talk about what the problem could be. Let's talk about, first of all, when it's too hot for the practitioner. I've got 2 Ontake here. Can you see this? These 2 bamboo, one is thick and one is thin. This one has got quite a thick skin, and this one is a very old and faithful bamboo. It's got quite a thin skin. So what happens sometimes is that the more you use a bamboo, then the thinner the skin is going to get. As time goes on, they get thinner and thinner, and they get hotter and hotter. That means they conduct heat much more swiftly. And that can become quite uncomfortable if you're holding them. So the first thing to do is to make sure that you've got a few bamboo, and some of them are thick and some of them are thin. The other thing that you can do is in the way that you pack the bamboo. Now, when we load MOXA into the center, I call that the plug, and you can compress it either very lightly or you can compress it very firmly. So the more that you compress it, then the less air can get in, and therefore it tends to burn more slowly and it doesn't get so hot. One way to control the heat is to make sure that not so much air is getting in and you've packed the plug really thickly. So that's a second way to control the heat. Just make sure the plug is very tight. And the last thing you can do is pack the MOXA at one end or in the middle. On page 18 of the book, there's a diagram with different kinds of packing techniques. Originally, when Shinma Sensei was first using bamboo, then the plug was right in the middle. It was like a central core. And compressed very, very tightly indeed, using his body weight to really compress the plug into the center. But when I started using bamboo, I extended the length of the core outwards to each end of the bamboo, which makes the ends much hotter when you're tapping with them. And it also makes the whole thing slightly hotter to hold. So what I would say is if you find that the bamboo is too hot, then just reduce the plug size and put it more in the center and make sure it's packed very tightly. And the last thing you can do if bamboo is too hot, is to get a bigger bamboo. So this is something that Philip Caudet in Spain developed. He calls it super Ontake. And you can see it's roughly twice the width of a normal Ontake that you get from, say, Sankei in Japan. It's about the width of my hand. So the idea is it should be about the width of a practitioner's hand. And what Philip does is he loads the bamboo into just one half. So if you divide the bamboo in half, then you bring the edge of the plug to the midpoint, and then you compress it so it's about 40% of that half is filled. 40% of the bamboo is filled just in one half. And again, on page 18 of the book, there's a diagram of how to do that. So the advantage of super Ontake is you can lever with them. You've got more leverage if you're pressing deeply. And also you've got a cold handle to hold, so you don't get hot when you're holding it. And that's a nice advantage. When you're rolling, of course, only one half of the bamboo is warm, so you have to roll with the warm half, not with a cold half. So that's the advantage of super Ontake, and I do like my super Ontake. I find it very useful. And the last thing you can do is use a smaller Ontake. So this is what I call Ontake Mini. This one hasn't been used. I think this one has. This is my Old Faithful. So that's another thing that you can do, is just use a smaller Ontake. And with these ones, I do the same thing as Philip. I put the plug into one end only and just burn lightly. And we should move on to if it's too hot for the patient. So there are some patients who are very sensitive to heat, namely children. They don't like heat, and also are sensitive patients. So what I would say is for those patients, particularly when you're working around the eyes or the face, if you approach them with a great smoldering brand, then they're going to get intimidated. So don't use super Ontake on the face or around the eye, but some patients feel quite comfortable with the mini Ontake. The other thing that Mika Takano in Japan does, she's another Ontake practitioner, is, and she gave me this, is like a nice cloth to, and you can just cover up one side of the face, and you can work through the cloth, and that will of course mitigate the heat. So those are things that you can do, and those are my 3 tips for reducing the heat. I'm going to also talk about sounds. What is the best sound to use? This is something that's come up recently in discussion in the Ontake group. Well, you always have to remember what the aim of the metronome is. The aim of the metronome is to give you a beat, and the aim of Ontake, or one of the principal aims, is to help the patient relax. So if you have your click sound kind of really loud, it's not going to help your patient to relax. So you want your click sound on the metronome to be ambient. I mean, I'm reminded of a story a long time ago. We did a charity fundraiser, and all the practitioners in our clinic were doing Ontake treatment, and we were raising money for a charity for this food charity. And one of the practitioners had an iPad, and he was, I think he was stressed, and he had it on full volume. So it was like hacking away this really strong clicking sound. And it was actually imposing into my room, in my treatment room, and some of the other treatment rooms, because it was so loud. And afterwards, I had a chat to the patient, and she said that the sound had been overwhelming. So she hadn't enjoyed her session at all. So when you start with your treatment, and you hear that the clicking sound is a little bit loud, it should be just in the background. So turn your phone down and make sure that the click sound is low. The other thing that people talk about, and I talk about in the book, is what kind of sound you should have. So again, if you remember that the aim of treatment is to help the patient relax, then there are certain sounds that are more relaxing than others. So those kind of very electronic beepy sounds are not so relaxing. So the ones that sound like a Casio keyboard or like a computer game, they're not really relaxing. They're not, you know, we don't have any association with relaxation. Whereas the more natural sounds like a snare drum or a woodblock sound, they do sound better. So natural sounds, low volume. And the last thing I'd say is that there are many apps that have kind of quite sophisticated accents because they're designed for musicians. It's large intestine time here, so we'll go at 108 beats per minute. So if you can hear this, you can hear that I've set an accent on the first beat. But actually, I prefer not to have that accent. I prefer to have a kind of more anodyne sound. So you can just tap, oops, there you go. So you can just tap on the, on tempo, you can just tap on the beat that has an accent until it disappears. And that sounds a lot easier, and that sounds a lot easier on the ear than having clicks. I'm going to do one more tip, and then I'm going to ask you to type in your questions if you have any. So my last tip is trying to answer the question that a lot of people ask, which is how long should I treat for? So imagine that you're working on the back. Like, how long should you do the back for? Or if you're working on someone's arm, how long should you work on the arm for? And the answer to this question comes very much to do with palpation. Now, in the book I describe, and when I teach, I talk to people about deficiency and excess, kyo and jitsu. So you are looking for reactions. When you stroke along a meridian, you're looking for reactions such as, you know, does the skin feel cold? Does it feel sunken? Does it feel rough? Does it feel like it's very vibrant and full of chi? Or does it feel like it's very drained and empty? Does it feel very tight? So you want to pass the Ontake along that area a few times and then palpate a second time and see whether any of those reactions have changed. So if it was cold, does it feel warm? If it was rough, does it feel smooth? If it was sunken, does it feel like it's got more energy? So as soon as you feel a change, then it's time to move on, because you've already created the change that you want to do. So it's a very different beast to treating, say, with Swedish massage, where you have to do maybe 8 strokes of effleurage, and then you have to do this with petrissage, and you kind of go through a routine. You're not performing a routine with Ontake, you're just trying to initiate and create change. So that's the main thing to do. Okay, so 3 tips really for Ontake. I thought I would just provide some content before I ask you for questions, but I see there are a few people in the group. Hi, Marek, it's nice to see you there. Thanks for your comments. Does anyone have any questions that you would like answered? And I'll see if I can do that. I'm hoping that you do. Okay, I'm not seeing any questions coming up. So, just to summarize for people who are joining this video now, this is a kind of reprise or an encore. I was doing a live feed and asking for questions, but I couldn't see any questions. But as soon as I signed off, I heard from one of the members saying, hey, Oran, did you know that there were people asking questions and typing questions in the comments? So I didn't see them. So my apologies for that. They didn't come up in my stream. So David asked me just to go back on and see if there are any questions. Okay, so David, your question is simply to do with over-treatment. You're worried that you're overdoing it and you're not able to take the pulse all the time to monitor your treatment. Yeah, sometimes when people are lying face down, it's hard to take the pulse and to make sure that it's kind of staying on track. So the thing to do is, in a way, decide what you're doing before you start, and decide what kind of patient you've got before you start. Because if you've decided that your patient is very robust, then you can do more robust kind of treatment. But if you've already identified your patient as being the kind of patient who reacts badly to too much treatment, a sensitive patient, then you just have to say, well, you know, with this patient, even if I can't monitor, I'm going to do less. Now, in the book, I think there's a chapter on dosage where I talk about something called the jitsometer, which is really a mind experiment, or a thought experiment. So the jitsometer is an imaginary dial that you place in front of every patient that you treat. Jitsu in Japanese means strong or excess. So in one sense, it can mean excess in a pathological way. And another way, it can mean excess in a sense of robustness, like someone who's in rude good health or vibrant good health can be jitsu in a good way. So if they give them 10 out of 10, then they're super jitsu and strong, and you can do lots of treatment on them. But if you give them a 1 or a 2 out of 10 on the jitsometer, it's just like a needle that kind of moves from one side to the other. Then you need to monitor, you need to do much less treatment. So even if you can't monitor the pulse because they're lying face down, or because they're, you can't keep doing it because your hands are full, then that's okay. You need to decide ahead of time what kind of dosage you're going to give, and then just stick to that and hope that you made the right decision. So that's what I would say. If you're worried about overdoing it, then limit yourself in advance and say, I'm only going to do 5 minutes of bamboo instead of 10 minutes. I'm only going to do 5 points or 5 areas instead of 10, something like that. So that's what I would say is decide in advance whether they're sensitive or not, and that way you have less risk of overdoing it during the treatment. Okay, any other questions? Any other? Hang on. Right. Okay, now I figured it out. Hi, Sylvia. Nice to see you there. So you're joining the reprise of the group. I figured out what I was doing wrong technically last time, is that as questions were coming in, I wasn't seeing them because my browser was just showing the oldest comment rather than the most recent one. Does anyone have any more questions to ask? Yeah, David, I see you've asked a question. Do I treat with Toyohari, needling, and Ontake in the same question? The answer to that is absolutely yes, I do. If you think that Ontake in its ideal form should be imported into any style of acupuncture, then it should mix in with Toyohari very well, and it should mix in with Manica style or with Kiko style or with TCM if that's what you're doing. So there's no reason why you shouldn't combine it with Toyohari, and I tend to. For the most part, you're using Ontake as a branch treatment, and in most styles of acupuncture, there's a clear distinction between branch treatment and root treatment. So if you do your main stuff with your own style of acupuncture, and then later you add bamboo as your branch treatment, then that's a really good combination. David, I see you've got one more question. Let's have a look. There are lumpy textures, and I'll stay a long time on them, and I'm not sure if it's too much. Sometimes they mostly dissolve. Sometimes there feels like some tension is remaining, and I wonder if I should stop anyway. Okay, so yeah, I think one of my teachers, Murakami sensei in Tokyo, described this phenomenon very well. Basically, if you think that during the course of treatment you want to get from point A to point Z, or point Z if you're American, then what happens is that during the course of a single session, you should be very happy to get from A to C or from A to D. So if a lumpy area has not completely disappeared during the course of one single treatment, that's really fine. If it's changed and it feels substantially softer, that's good enough. So you don't have to keep banging on. And in fact, that might be counterproductive. So what you need to do is just roll a little bit, and once it's felt like there's some substantial change, then move on to the next thing. And you may find that when they come back a week later, that is actually much better than it was when they left. So that's what I'd say, is don't try and get from A to Z in one session. Just try and go from A to C. Joe, you're treating an elite athlete and he's worried about MOXA from a doping angle. He's worried about inhaling the smoke. Okay, I don't think MOXA is a prescribed substance in any way. I don't think it has any stimulating effects. I think that's something that, are there any chemicals within MOXA that would show up on a test? I don't know the answer to that. Certainly there's nothing illegal in MOXA, so it's not like he's going to be accused of smoking marijuana if he inhales MOXA smoke. Not only that, but I don't think there are any stimulants within mugwort that, you know, it's not like ephedrine, it's not like is mahuang, the herb? I'm not a herbalist, but it doesn't have any of those things which are prescribed in it, as far as I know. So I think, Joe, that you can tell him about that. And you can also reassure him that the amount of smoke is really, really small. It's not like he's even, you know, passive smoking the equivalent of a cigarette. And you can open the windows. The other thing that you can do to reduce the smoke is to compress the plug, as we were talking about earlier in the first coaching call, is to compress the plug as much as you can, because then you'll get much less smoke in the room. So I think those were three things that I would say for your elite athlete. I'm just going to scroll down and see if there are any other questions that I haven't answered. And apologies to all the people who were in the first coaching call where I didn't see your questions. Okay, David, you've asked another question with regard to Kike. So in Toyohari, sometimes we use the 8 extras. We place a piece of copper on the master point of the 8 extras, and we place a piece of zinc on the couple point. And then following that, once we've tested the points with those metals, then we do MOXA on the master and couple points, and we use that for treating symptoms. So David, yes, absolutely. That's the time when I usually do my Dr. Tan treatments. So I'll put the zinc and copper on the 2 points, and then I'll go to the limb or the image, and I'll do my Dr. Tan pain relief treatments. I find that's the most useful time to do Toyohari, to do Ontake. And after I've done that pain relief treatment, then I'll remove the zinc and copper and finish with OQ. And that means that the zinc and copper is on for longer than is prescribed in Toyohari. But I see nothing wrong with that, as long as the pulse kind of does what it's supposed to do. So yeah, that's my response for that. Hi, Rola. Nice to see you here. Okay, I'm looking for another question, but I'm not actually seeing any. Then I think it's enough. Thank you very much, guys, for tuning in. There will be some, you'll be able to watch this again, and other people will be able to watch this. So thank you if you're watching on the broadcast. Thanks if you're watching on the replay. I actually screwed up a little bit. I didn't see any of the questions on the first thing, so there are actually 2 group coaching calls to watch. Anyway, next time I'll know better, and I'll know how to scroll down to see what the questions are. One of the things that really help authors is book reviews. So I'm very grateful for all of you who've bought the book and are enjoying the book, and you bought both the Kindle version and some of you have bought the paperback as well. So you've got 2 versions. So thank you very much. One of the things that you can do to help is to leave a book review on Amazon, because Amazon book reviews really help other readers to decide whether or not they want to get the book and whether or not the therapy and the book is worth it. So peer reviews are really, really helpful, and it would be great if you could do that. So anyone who's bought the book, if you haven't done a review yet, please do take the time. It doesn't have to be an essay. It can really just be a paragraph or 2 paragraphs just saying what you liked about the book. Maybe you like the pictures or the illustrations. So just say that. Okay, I'm still not seeing any questions, so I think then that I will try and finish. If you find this kind of group coaching call helpful, then I'm thinking of doing it on the first Sunday of the month. So if you like it and you would like more, then please put a comment here into the stream, and I'll schedule another one. Was the content helpful? What kind of questions would you like answered next time? Feel free to put questions into the event ahead of time so that I can answer them and I can anticipate them. Okay, if there's going to be no questions, then I think what I'll do is I'll end the call and we can try again for next time if you fancy, if you'd like this to happen again. So thank you very much to you, Marek and Caroline and Joe and April, for watching and tuning in. And hopefully next time we can get more questions. Thank you very much for watching. This is Oran in Kuala Lumpur. Bye-bye.